This first case Articles on the Go feature is titled Surgery Block Utilization, written by Paul Wafer, BS, MBA, RN. How can we increase overall room utilization in surgery? Generally, most hospitals with block scheduling programs have a policy on release time. Basically, if a surgeon is going to be away on vacation or at a meeting, or is just having a slow week, they must call the scheduling office before a certain time frame. If they do this, they are given credit for the time, and it does not count against their block utilization at the end of the month. Frequently, the time frame for releasing rooms is just a few days or maybe up to a week. Additionally, this release time is generally the same for all practices and specialties. When the release time is less than a week, it's often difficult to fill the block with other physicians' cases, which leads to gaps in the schedule. The release time given to a specific practice or physician should be based on the type of practice and/or specialty. For example, if a practice or specialty frequently covers the emergency room, that practice should have a shorter release time. Both general orthopedics and general surgery may fall into this category. There are also a number of practices that are typically scheduling elective surgery that may be scheduled several weeks into the future. In that case, the release time could be 2 to 3 weeks prior. This method gives the hospital sufficient time to fill the scheduling gaps and the ability for those surgeons with a busy ED practice to schedule their patients in a timely manner. Room release time should be assigned by the governing body empowered to oversee blocks, and all block participants should have release times. However, these practices or surgeons should not get credit for this time in their monthly utilization results. The rationale for this is twofold. First, blocks should be reviewed on a quarterly basis, not monthly. Even if time is released in one quarter, there should be enough volume over the quarter to meet utilization goals. Secondly, some surgeons are very good at releasing block time weekly. One surgeon was observed whose block utilization report cited a 75% utilization rate due to time released, when in reality, the surgeon only utilized 25% of their time. The ultimate goal of blocks is to improve the overall utilization of the OR by rewarding those physicians that consistently use their time. By taking a deeper look at how block time is released at your facility and determining whether or not it is specialty specific or if you have a one-size-fits-all approach, you can increase overall room utilization within your department. As always, thanks for listening to this episode of First Case Articles on the Go.